OMRON and Tricog Health launch, KeeboHealth to combat India's cardiac crisis and drive going for zero. Vision KeeboHealth, a transformational AL-powered platform, revolutionizes remote cardiac care across India. Bangalore, India, 10th July 2025. OMRON Healthcare, a global leader in innovative home health monitoring solutions, has expanded its collaboration with Tricog Health, an AL-driven cardiac care company, to launch KeeboHealth, an advanced connected health platform designed to transform remote cardiac care and accelerate progress toward OMRON's ambitious Going for Zero vision, a world with zero cardiovascular events. KeeboHealth is a groundbreaking digital health ecosystem that leverages state-of-the-art AL technology, real-time data analytics, and home-based monitoring to empower healthcare providers and patients in managing heart conditions more effectively. The data flows in real time to Tricog's AL engine, which continuously monitors heart health, flags early warning signs, and instantly alert medical teams when intervention is needed. This proactive system helps detect heart issues before a patient's condition deteriorates, significantly reducing the need for hospitalizations. The platform integrates seamlessly with OMRON's range of connected devices, including home ECG monitors, blood pressure monitors, and weighing scales, enabling continuous and personalized care.
Dr. Charit Bograj, founder and CEO, Tricog Health. Distinguished guests, ladies and gentlemen. Today, on behalf of Japanese Consul General Nakane, who is out of country now, I am honored to make a few remarks about innovation in the healthcare sector between India and Japan. India and Japan share fundamental values such as democracy, and we also have many historical and cultural similarities. Building on this foundation, the two countries are deepening cooperation in a wide range of areas, including politics, economic cooperation, and people-to-people exchanges.
Million lives are lost due to cardiovascular disease, and 3 million of those from India alone. Fathers, mothers, sisters, brothers, friends. This is just not a statistic, but a cardiac crisis. Today, India has become the diabetes capital of the world with over 100 million diabetics. And even worse, 130 million pre-diabetics will become diabetics over the next couple of years. But there's a bigger silent killer: blood pressure. 30% of Indians have blood pressure. And in urban society, that number is close to 40%. And the worrying fact, half of these people are unaware that they even have blood pressure. And 1 in 5 have that under control. And blood pressure is slowly damaging the blood vessels in one's body, causing a heart attack, causing a stroke, causing atrial fibrillation, causing heart failure, kidney damage, and death. These two combined diseases are fueling the cardiovascular epidemic in our country today. And the repercussions are tremendous. India alone would have spent $2.1 trillion by the end of 2030 to manage these patients, and the economic impact is very high. What is even worse is that in India, heart disease comes a decade earlier than in the West.
And also how we bring a healthier life in India. And to start with, I'd like to touch on our history very briefly. This is our founder, Kazuma Tateishi, who founded the OMRON Corporation in 1933, and then he started to developed research the medical device in 1960s. So he had a very strong desire to live long and disease-free life, having lost his wife to cancer in a younger age. So he believes that the human health could be prevented if we manage well. So it is important to measure the degree of health. So that's why we started to develop a monitor or to the measuring device. So, and then what will be the measured at hospital will be measured at home. So this is the kind of start for us. And this is our mission to advance health and empower people worldwide to live life to the fullest. This is our promise. And then we are also proud of creating culture of measuring blood pressure at home. So in 1973, the first digital blood pressure monitor was launched, but at that time, most of the professionals believed that the measuring blood pressure should be done at hospital, not at home. So to prove its importance of measuring at home, we started the study, which is called Ohasama study in 1986. Ohasama is a very small town in the north part of Japan, and we started to take blood pressure of residents at home, and actually it still continues. And it shaped the global standard, 135, 85 mmHg for home blood pressure.
Blockage in the blood supply of the heart. So think of how people say, oh, I have severe pain and chest pain and left arm pain, and they rush to the hospital. Heart attacks means that there is a part of the muscle that gets damaged. And that part of the muscle usually is one portion of the heart, not the entire heart. So a person with heart attacks very rarely may just suddenly collapse, but it will give them enough time to seek out medical attention. Sudden death or sudden cardiac arrest is sometimes a consequence of a heart attack, where what we call an arrhythmia, and these are ventricular tachycardia or VT or ventricular fibrillation or VF, the heart suddenly quivers and then just stops beating. So in a heart attack, the heart is beating, but it is crying out in pain. In sudden cardiac arrest, the heart quivers and the electrical system of the heart shuts down, and then it stops beating and the patient collapses. Heart failure is, as I said, a disease that most people do not know. For those people who survive a heart attack or who have uncontrolled blood pressure, the heart becomes either weak or it becomes very stiff. In both of these conditions, it is unable to perform and give the rest of the body enough blood. And as a consequence, when you walk, climb a flight of stairs, you become breathless. And that is heart failure. So a sequelae of a heart attack or uncontrolled blood pressure is heart failure. And that is one of the most dangerous diseases that you can have. So today God came and said, Dr. Charit, you can have either common cancer or heart failure. I will select common cancer. The chance of surviving a common cancer is much higher than surviving severe heart failure. And it is very important that we manage these risk factors before any of these occur. And when they do, our goal with working with OMRON is to make sure that these patients are managed to the best of their ability, get the right treatment at the right time, at the right dose from home. I'll move on to the next question that you asked. And I'm very privileged to be one of the implementing partners for the heart attack program that the government of Karnataka is doing. And as a cardiologist, I want to tell you this very, very clearly, that no vaccine causes a heart attack. Vaccines that were given in India cause an immune reaction that lasts for a short time, and the body builds up an immune memory, so that next time you get a COVID infection, the severity comes down. The problems with vaccines are there are few people who develop an allergic reaction, and that can happen with any injection. It can happen with paracetamol tablet. Rare. So vaccines do not cause heart attacks. And does COVID cause heart attacks? And that is a very hotly debated topic. Long COVID, where there is evidence that the virus immune response still continues afterwards, causes the blood to become thicker, causes more heart attacks. So during the time of lockdown, during the time of Delta wave, as a cardiologist, so many of us saw heart patients coming in more, simply because the blood was thicker.